Imagine this, you're in excruciating pain as you're trying to go to the bathroom. It's painful, it's burning, it feels like somebody's stabbing your bladder. There's blood in the urine. You're convinced you have a UTI or a urinary tract infection. You go to your doctor who checks your urine and lo and behold tells you your urine culture is completely normal. You don't have an infection. What? What on earth is happening? If you've been in this situation, then keep watching because today we're going to talk about bladder pain syndrome, often known as interstitial cystitis. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon, and welcome back to the channel. Here we talk about everything pelvic health, so if you're new and you like what you see, don't forget to subscribe and share it with a friend. So let's start with what is bladder pain syndrome. So bladder pain syndrome, or as I mentioned, often known as interstitial cystitis, is a chronic pain condition where patients can have symptoms of bladder pressure, pain, discomfort, burning. Oftentimes they'll notice blood in the urine. There's a lot of urinary urgency, frequency, where they feel like they're going to the bathroom every few hours, if not every few minutes. It literally feels like a raging UTI or a raging urinary tract infection, but the big difference is for patients who truly have a bladder pain syndrome, when we check their urine, the urine culture comes back negative. That's how we differentiate between patients who have a true infection versus somebody who's suffering from bladder pain syndrome. And the reason it's important to differentiate is because the treatments are different. A UTI is an infection, so you want to treat it with an antibiotic. The bladder pain syndrome, on the other hand, has a completely different pathophysiology, which we will discuss today, but the treatment for that is not an antibiotic. Believe it or not, it is more common than you think. In the United States alone, there's about 4 to 12 million women who suffer with these conditions, and many of them are underdiagnosed. And it can be a really debilitating disease to have because oftentimes these patients are young women who are suffering and they're in pain, and it causes a lot of physical, emotional, and psychological drain. A lot of these patients often have severe anxiety from their symptoms and go into depression and oftentimes isolate themselves from society. So it can be a very lonely disease to suffer with, which is why it's so important to understand the symptoms, understand the causes, and also know what are some things that you can do to help yourself if you're suffering with these conditions. So let's talk about what are some of the causes of bladder pain syndrome. Exact cause of bladder pain syndrome is unclear, and oftentimes it's what we call a diagnosis of exclusion. So what that means is when we have patients who come in presenting with symptoms such as urinary urgency, frequency, burning, pain, we always want to rule out the obvious thing. For example, you want to rule out that the patient doesn't have a urinary tract infection by doing a urine culture. A lot of the times we'll do a procedure called cystoscopy where we can look inside the patient's bladder with a tiny camera. Again, we're trying to rule out any kind of bladder issues such as bladder cancer or other pathologies of the bladder, or maybe any kind of foreign objects that could explain their symptoms. In the absence of these symptoms, if patients are still suffering with these symptoms of burning and pain, we say that it's most likely bladder pain syndrome. So going back to the causes, there are many theories of why bladder pain syndrome happens. The number one reason is damage to the bladder lining. And this could be because of irritants in the urine, which can cause damage to the bladder. The second reason is that it's kind of like an autoimmune response, which means that your own immune cells are attacking your bladder by mistake. The third cause is thought to be hypersensitive nerves or nerve abnormalities, which means that the pain receptors are overtly sensitized and the pain signals can be often exaggerated. Now, there's no single trigger of why patients can have bladder pain syndrome, but there are many factors that can cause patients to go into a flare. Some of the common triggers that I talk to my patients about is certain foods can make their bladder very sensitive. Foods such as caffeine, soda, alcohol, spicy food, citrusy food, chocolate, believe it or not. Stress can be a big risk factor. Stress can affect their hormones, which again can make the patients very sensitized to feeling some of these symptoms. Another reason can be any kind of physical activity or even sexual activity. For a lot of patients, certain exercises or certain kind of body postures can trigger something which makes their bladder very sensitive. A lot of my patients notice that after sexual intercourse that they feel that they're going into a flare. A lot of my patients suffering with bladder pain syndrome also have something called myofascial tenderness, where they have really tight and tender pelvic floor muscles. So sex can be very uncomfortable. both because it can make the bladder very sensitive, and also the pelvic floor muscles can be really tight, which makes it very difficult with penetration. So how do we diagnose bladder pain syndrome? Unfortunately, there's no one test that we can use. As mentioned before, the first thing I do when I have a patient in my office who's coming and presenting with these symptoms is check their urine and make sure they don't have an infection. Because if they do have an infection, that treatment is completely different. Oftentimes, we're treating the patient with antibiotics. In general, it's very important to take a good history. I'm asking my patients about when did their symptoms start? Is this something that just started recently, or they've had it for many, many years in their life? Is there any pattern? Do they notice that they have certain triggers, whether it be certain foods, certain activities, stress in their life? I asked them about any past history, any medical history, any surgical history, any history of any trauma or abuse, what their bladder symptoms are like, how often are they going? Or do they have urinary urgency, frequency? Do they notice that they're getting up at night many, many times to go to the bathroom? Are they not able to control their urine? Do they notice any other symptoms, such as pain with intercourse or blood in the urine? After a thorough history, I do a good pelvic exam. And during pelvic exam, I'm starting to look at the anatomy from the external genitalia, and then also doing an internal exam. There's no masses or lesions or signs of infection vaginally that could explain some of their symptoms. Oftentimes, I would recommend doing a cystoscopy, which is a quick procedure we do in the office where we put a tiny camera through the patient's urethra to look inside the bladder. It's very quick, it's very easy, and most patients tolerate it very, very well. But with that procedure, it allows us to view inside the bladder. So if there's any damage to the lining of the bladder, we're able to see that. If there's any abnormalities in the bladder wall or any other pathology, we can identify right then and there. And the good thing is I can have the patient see the monitor with me, so they're able to see exactly what I see, which is actually nice for the patients because then they can actually feel involved in the whole diagnostic procedure. So how do we treat bladder pain syndrome? The first thing we do is focus on lifestyle modification. Remember, we talked about that there are many triggers that certain patients have, whether it be certain foods, whether it be stress, whether it be certain physical activity. We talk about reducing those triggers. If there are certain foods that patients are sensitive to, we talk about cutting those down. If there are known triggers for certain patients, then avoiding those triggers can be really helpful. Focusing on stress reduction techniques, whether it be with exercise, whether it be with yoga, acupuncture, swimming, whatever it is that patients can do to help relieve their stress can help with their symptoms. Now, it's easier said than done, and I completely get it. But again, it's a discussion we have to come up with a plan together so we can best help their symptoms. Sometimes working with pelvic floor physical therapy to work on relaxing their pelvic floor muscles can be really helpful. Because again, a lot of my patients who have bladder pain syndrome also notice that they have very tight pelvic floor muscles, and then relaxing and learning how to relax those pelvic floor muscles can help improve their bladder pain syndrome. There are some oral medications that can help with this condition. A lot of those medications are nerve medications, and they do have some side effects. So if a patient wants it, we talk about what are some potential side effects and how it may affect their quality of life, and then we come up with a plan that works for them. There are also invasive procedures such as bladder installation, where we fill up the patient's bladder with a cocktail of different medications that oftentimes include like a numbing medication, some salts, some steroid. And the idea is, if the patient is in the middle of a flare, that cocktail of medications can help calm the bladder flare, calm some of the inflammation, and give them some relief. We also do something called cystoscopy with hydrodistension, where we fill up the patient's bladder with fluid and stretch the bladder wall. And that stretching can help relieve some of the pain and discomfort, whether it be from scar tissue or hypersensitive nerves. This procedure, we do have to do it in the OR so we can give the patient some sedation so they're comfortable. There's some other procedures which can help with the urinary symptoms, such as the urinary urgency frequency, such as injecting Botox into the bladder wall, as well as the bladder pacemaker, which can be really beneficial in helping patients with the urinary urgency and frequency symptoms. These two will be off-label use for the bladder pain syndrome, but oftentimes, many of my patients who suffer with the bladder pain also have a significant amount of urinary symptoms, and helping improve their urinary symptoms can give them some benefit with regards to managing their pain as well. I do want to stress over here that bladder pain syndrome or interstitial cystitis can be a very isolating disease, and oftentimes it can be really difficult for patients to cope with their symptoms. So I would encourage my patients to try to find some support group. There are many support groups online, there are many social media groups. finding other people who are suffering and having some of the same symptoms can be a source of comfort for many patients. It also makes you feel less isolated. Let's talk about a few myths that patients often have about interstitial cystitis. The number one myth is that it's probably an infection and I'm just going to treat it with an antibiotic. That's the wrong attitude to have. And oftentimes I will hear patients say, oh, I had some burning and discomfort. I called the urgent care. They just gave me an antibiotic. Now, yes, it works if you truly have an infection, but the point is, without testing your urine culture, we don't know if you had an infection or you have a bladder pain syndrome, which is why I always urge my patients that even if you feel convinced that you have an infection, it's very, very important to test your urine. And when I say test your urine, I'm talking about getting a urine culture done so we can see whether or not there's bacteria growing in your urine. And that usually takes a few days. So if you go to a doctor's office and they do a quick office test and tell you that your urine is fine, that's probably not a urine culture. That's probably what we call a urine dip, which is a quick and easy test that we do in the office. But to get a true assessment of whether or not you have an infection versus bladder pain syndrome, it's very important to get a urine culture done. So next time you're at your physician's office or at an urgent care, please let them know that you'd really like them to test your urine with a urine culture so that they can know whether or not there's bacteria in your urine. And finally, the third myth is that patients who have bladder pain syndrome are always in pain. And that's not true. There are patients who are in pain for long periods of time, but that's usually when they're in the middle of a flare. I have many patients who only have pain when they're in the middle of a flare and then their pain subsides. Now, it is a chronic condition, so you're never going to be disease-free, but many times with the right treatment and with the right approach, we can get patients to a point where they're able to live a fulfilling life and not be in pain all the time. So if you're somebody who's suffering with these symptoms and you know you have bladder pain syndrome, I want to leave you with hopefulness. Understand that just because you've been diagnosed with bladder pain syndrome doesn't mean you cannot have a fulfilling life, that you're going to be in pain all the time, that there is no help. Yes, sometimes it can be a very frustrating disease, both for the patients and for the physicians, because we feel just as helpless when we're not able to help our patients. But know that with the right treatment regimen, with the right specialist, we can come up with an individualized plan that works for you. And that's really the key. Bladder pain syndrome and interstitial cystitis is a disease which requires a very individualized and a very nuanced treatment plan. So finding the right physician who can help you can be really critical. Thank you for joining me today to learn about bladder pain syndrome. Hope you found this video helpful. Remember, taking care of your health is not a luxury, it's a necessity, and it starts with awareness, with education. Hope this video was able to educate you. If you haven't already, don't forget to subscribe. And if you want more helpful and up-to-date information about your pelvic health, you can also sign up for my newsletter, which will be linked below. Hope to see you soon. Bye!